was going to talk about a special category of trauma here, and that would be the burn patient. And again, this was going to be a little bit on the long side, not too bad, but again, I'm not going to go over everything in super duper detail. You're going to need to read your book, and you're going to need to do your chapter work on this and look at the slides. But again, 3 to 5% of burns life-threatening. That's kind of a normal. And the greatest risk for serious burns is you're old, you're young, and again, you're workers. And again, second leading cause of death in children under the age of 12, and fourth overall cause of trauma death. And they usually don't die from they sometimes die from the burns, but the biggest thing is the infection afterwards. And I think that the reason that is because, again, we do a lot better care of trying to maintain sterility on these patients, which makes a huge, big difference. Again, the reason that we've had a lot of burn decline is because, again, we've got better sprinklers, we got better fire codes, smoke detector use, safer construction. Things don't catch on fire like they used to. And again, we've got systems in place to help that. So again, this affects the skin. Again, it's the largest organ in the body, and it is durable and flexible and able to fix itself. But the problem is when you get the burn too deep into the area that does the repairs, that's where you get the problem. Again, the epidermis is the outer layer. It goes into the dermis, and then that's where your blood vessels are. And then the sebaceous glands and everything's in there, and then that's in that the lower layers, the subcutaneous or the fat layer, and it's the insulation against trauma and heat loss. But again, all of your underlying structures lay in those underneath, just up underneath that skin, which does all the protection part. So remember that it's an organ of sensation. It can perceive temperature, pressure, pain, and again, it contains body fluids that controls the loss of to the environment. So it can cool us down, it can hold on to heat. It's one of the wonderful things about skin. The problem is that when it gets damaged in a large extent, that's where we have a little bit of problem. And so when we're dealing with the burns, that's the problem, is that we lose that functionality of the skin. And again, it can cause major problems. Now, again, the thermal burn is caused by, again, heat. Again, it can also be caused by chemical changes, and it's a result of extreme heat exposure. And again, the extent of the burn injury is related to how much heat energy is transferred. Again, skin temperature, concentration of the heat energy, and the contact time. Again, time distance shielding is the protection for that. But again, the greater the agent's temperature, the greater the potential for the damage to cause. So again, if you got an alcohol that burns at 105 degrees, probably not going to do too much to us. If you got a phenol that burns at 800 degrees, yeah, that one's going to cause a lot more serious burn. Okay. Now, Jackson's theory of the thermal wound is the physical effect on high heat, and it has the clinical effects. Okay. Nice little trivia contest thing to know. Again, the zone of coagulation is the most damaged area. And so that's what we're looking at here, is the zone here is the most damage. The static zone is around that, and then again your hyperemia, where you're trying to repair that damaged tissue. Okay, and now the emergent phase, the body's initial reaction, that's usually the increase in the swelling. And then following the initial phase can last up to 24 hours, and it's larger than 15 to 20% of total surface body area. You start get a fluid shift into that region, which is why we start to hydrate these guys a lot sooner, and we do it over time. We don't just bum rush them and fill them full of fluid. We just slowly instill it. That's where our Parkland formula comes into play. Now, again, the hyper-metabolic phase is days or weeks after the burn, and the body's demands for nutrients begin to process the repairing tissue, and the resolution phase is when it lays down the scar tissue and it starts to remodel, rehabilitate, everything goes back to normal. Now, electrical burns, these guys are called by the voltage or the pressure of the electric flow, and then the current is the amount of amps. Voltage is usually in volts, amps is your rate of current. The direct current is electrons flowing one direction. Alternating current, it reverses in short intervals. Your AC plugs, by the way, are alternating current. If you plug something into the wall, it's alternating current. If I'm dealing with a model train track, that's usually direct current. We we put our fingers on both sets of the tracks, turn the power up high, ooh, it tingles. Okay, and the reason is it only tingles and it doesn't hurt because the voltage is about 12 volts, and it's about maybe 1/10 of an amp. So again, now resistance to electrical is your is known as resistance, or is measured in ohms, and an ohms mol is the relationship between the current, the resistance, and the voltage. Okay. So the skin is highly resistant, by the way, to electrical flow, but the problem is there's usually moisture or sweat on the skin, which therefore lowers the resistance. Now, nervous tissue is conducted electricity as well, so if the voltage is strong enough, it can go into the body and actually heat is created. And the problem is it generates that heat wherever the path was. And so it can cause burns literally from wherever the wound entered to the exit. Okay, and so all through there, you're going to develop heat energy as well as electrical damage through that tissue. Okay, so it can definitely, this is just a simple entrance wound from the line, and again, this is an electrical exit wound. You're not thinking much, but it can actually break bones in between there because of the damage. It really destroys any tissue in between if the energy level is enough to do so. Okay, now, electrical burns greater than 50 milliamps may disrupt the heart's electrical system. So if you've got an electrical burn of any time, a cardiac monitor is absolutely a must, okay? Absolute must. All right, and the other problem is, by the way, that damaged tissue starts releasing potassium. Another problem, okay? Now, your chemical burns denatures the biochemical makeup of the cell. So it actually destroys the tissue before it can destroy tissue before it can chemically burn any deeper. So the common cause is your strong acids or your strong alkalis, okay? So this is an acid burn to the ankle. And by the way, the secret to pollution is dilution. Water, wash, unless, of course, it's an oil-based or a phenol, in which alcohol is going to be your methodology of getting those off. Okay, so acid burns cause immediate pain. Alkalis limited pain, but it's a protective coagulum. But the problem is it starts sloughing off the skin. So it starts a liquefaction, necrosis of it. And then the alkalis allowed to penetrate, and it can cause deeper burns. And alkali burns, by the way, your Drano, it would be a quite serious type of burn. Now, radiation injuries, it's usually the ionization is where it actually travels, the particles travel into substances, and then they affect it in the cell damage, it dies, it produces damaged cells, okay? Alpha radiation is a very weak energy source, but it's actually the most dangerous if they inhale it or ingest it. Beta radiation, it's a little bit more energy focused, and it can cause injury as well, but your gamma rays are the most powerful ionizing radiation, and it requires the most shielding in order which to do that. Now, neutron radiation is very uncommon outside of a nuclear reactor or a bomb, and unshielded people are exposed to strong radioactive sources. And again, contamination by dust or debris, that's what we're kind of worried about with the radioactive fallout material. Now, again, how do we protect ourselves? Time distance shielding, okay? And time, which means we limit our exposure to the material distance, get as far away from it as you can, and have the protective layers, and sometimes the multiple protective layers, okay? Geiger counter is what we use to measure the radiation emissions, and a dosimeter is the cumulative. So the little things that they wear on their collars with the x-ray techs, that's a dosimeter, versus the Geiger counter is the one that you weigh around and tick, 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 tick. Some of the more modern ones don't actually tick like that. Again, whole body exposure as radiation dose increases, the symptoms start to show in more severity. Usually the first sign of a radiation injury is slight nausea and a little bit of fatigue. And then if it's a lethal dose, the nausea increases, you start losing, you get a lot of weight loss, vomiting, diarrhea, malaise, and then eventually the fatal dose, you'll get confusion or watery diarrhea, and then again the physical collapse of the patient. And again, prolonged exposures, guys, cancers, infertility problems, those are the big two that come from that. Inhalation injuries. Now, we worried about these suckers. Heated air gets into the airway tract. Heated air, steam, flames, okay, causes swelling. Swelling, they get worse quick. And we preach this: when we have an airway burn, we secure the airway, period. Because I'd much rather secure it before the swelling starts than after the swelling occurs. If they're not swelling at all, guess what? They can take the tube out once they get to the hospital. Now, toxic inhalation is when there's resins or plastics and they release toxic gases as they burn. Usually these kill pretty quickly, by the way. Cyanide, hydrogen sulfide, hydrogen fluoride, caustic substances, all of these guys burn quick. And again, the inhalation burns, if they breathe that stuff in, they usually don't survive it. Carbon monoxide is usually tasteless, odorous, and again, initially you get a slight headache, a little bit of confusion. They get worse, eventually get to the point where the person, it displaces oxygen on the hemoglobin, and of course they are not able to do any type of cellular respiration. Long and the short is they die because they're oxygen deprived. Okay, and again, they high index of suspicion, by the way, when the temperature drops and they're using a non-approved, non-ventilated heater source. And of course in Florida, generators inside while the hurricane's going on. Oy jamoy. Okay. Yeah, again, carbon monoxide buildup. Next thing you know, we find 5 or 6 people dead in the house because then they didn't use proper ventilation. Remember that it does affect the young, the elderly, and if you got a pregnant patient or pre-existing heart disease, the CO poisoning is going to affect them a whole lot quicker and faster. Again, remember, if you got an airway thermal burn, you got to make sure that airway stays open. And the problem is what happens if it gets in the lower airway? So you're going to have a severe pulmonary edema coming from that, as well as actual blockage of the airways. It's kind of crazy, and it's very difficult to manage those patients. Again, superheated steam can actually cause subglottic or lower airway burns. Hopefully not. Stridor or high-pitched crowing is usually a great sign that you've got upper airway swelling. And again, it's that stridorous, croupy type sound. Again, at that point, hopefully you've got them intubated already, but if not, you're in for a rough ride. Now the burn depths, again, superficial or first degree, the partial thickness second degree, and then of course a sunburn is kind of like a really bad first degree burn. It usually goes just to the thermal process. Ultraviolet keratitis is when the welder arcs, again, and they're not using proper eye protection, and so therefore you burn the outermost part of the eye. And then full thickness burns is a third degree burn. Again, so I would probably know the difference between superficial, partial thickness, full thickness, and the other names for those. Now, how do we measure burns? Again, this is back from EMT school, gang, rule of nines. Every part of the body is 9%, except for there's the crucial 1%. We all know where that is. So again, infants and child anatomy, a little bit different. So the head in an adult, head is 9, upper torso 9, lower torso 9, back is 9, lower back is 9. So to combine, these are 18, of course. Each arm, 9 total. Okay, each leg, 9 total. Okay, and that would be the anterior and the posterior. Okay, now with the kids, the head is actually 18, the front and the back, and we take that extra from the legs, so we cut down on the legs for that. Okay, so again, the rule of palms, the patient's palm size, 1% body surface area, and again, it works on the adult, child, or the infant, and it gives a little bit better approximation of the size of the burn. So again, whatever the palm size of the patient is, not your palm size. Okay. Now, hypothermia, because the problem is that remember, when the skin gets burned, it loses its ability to function correctly. So you can have the patient go hyper, and most oftenly hypothermic. Okay. So again, if burns are extensive, you got to make sure that you control body heat loss. Okay. Make sure to cover them up. Sterile sheet and then a warm blanket. Okay, sterile sheet first, then a warm blanket. All right. Remember that you also lose the volume. So again, they can easily go hypovolemic. They'll start the third space. They'll start the fluid shift. Again, in the way that and it takes hours to develop. And the good news is we can usually get ahead of that trend by using the Parkland formula to fill them up ahead of time. Okay. And we'll go over Parkland formula a little bit later. The eschar, again, this is the actual burned, leathery, hard material. Problem with eschar, if it's in the thorax, it can interfere with breathing or it can cause compartment syndrome. Okay, and so what they'll do is what's called an esterotomy. So they'll actually go in and surgically cut these to allow the fluid to expand. And again, this is actually a life-saving procedure that they do at the hospital, usually upstairs in the burn center. By the way, if you go to a burn center, don't be offended. They're going to bring them into their area. They're going to hopefully transfer them, and they usually transfer them in the most sterile way possible, but you're not going to be allowed to go back with the patient. Even it was Shan's care. We went to the door. There was one little room. We transferred care, and then they took over. Okay, that's the way the process works. Because again, they're maintaining a very sterile environment, and the reason for that is because of infection. Again, it's the most persistent killer of these people, and so we want to prevent them and do anything possible to prevent any type of patient infection to come in. Remember, the skin is the first barrier for that infection process. If it's destroyed, guess what? Organisms can just come right on in. Now, organ failure. Again, unfortunately, you get tissues that start damaged. They start releasing myoglobin. They start releasing potassium. And, of course, these can lead to kidney failure, liver failure. It can lead to heart arrhythmias. And it can actually lead to cardiac arrest if the damage is so far along. Again, and that usually takes a little bit of time where in the EMS and we get there immediately. What happens if they sat there for 3 days? And we've had patients that they've actually done that. And they're pretty much, it's unfortunately, we're probably dealing with a death sentence there. Again, remember that your special needs patients, by the way, they have trouble maintaining their fluids. They have a lower fluid reserve. So the older pediatrics and the people that are already sick are more susceptible to a burn injury. Okay. By the way, unfortunately, we got people that actually do this on purpose and look for mechanism of injury that don't make sense. Little kids, when they jump into a bathtub and it's too hot of water, they jump out. Okay, they don't stay there. All right, or they only put one leg in. They don't get both of them or just their buttocks burned. Okay, cigarette. They say that they dropped a cigarette on themselves. Well, if they've got multiple burns, they didn't drop it on themselves multiple times. Okay, and again, trim to avert the burning water, or they will attempt to move from these areas. So if you've got circumferential burns like this, yeah, more than likely this is not because the kid was hopping into a thing of hot water. This kid was dunked into a part of hot water. Okay. Now, physical abuse, again, they can actually have people that they do this in a ritualistic way, brand people. Again, I don't understand it, or again, they will do that. And again, make sure that you report these to the emergency departments and make sure the local authorities know this as well. All right, we're going to hold up here because then we're going to get into the assessment on the next part, and we'll see you guys on the next one.